Anticoagulants, PEBC Evaluating Exam Practice Questions. Question number 1. A 68-year-old man with atrial fibrillation is stabilized on warfarin with an INR of 2.5. He develops a respiratory infection and is prescribed trimethoprim sulfamethoxazole. What is the appropriate action? Options: continue the therapy with no changes, increase the warfarin dose, monitor the INR closely and consider reducing the warfarin dose, stop the warfarin immediately. So, patient is having atrial fibrillation, okay, and warfarin is given and he is having an INR of 2.5 and he has developed respiratory infection. So the physician has prescribed him trimethoprim sulfamethoxazole. Now they are saying what is the appropriate action you are going to take. Continue the therapy with no changes. It's the wrong answer. Increase the warfarin dose. No, you're not going to increase the warfarin dose. Then monitor the INR closely and consider reducing the warfarin dose. Yes, this is the right option. Stop warfarin immediately. No. So, the right answer is C. Why? Trimethoprim sulfamethoxazole inhibits the warfarin metabolism. What is happening? Warfarin metabolism is inhibited by which drug? Trimethoprim sulfamethoxazole. Since metabolism of warfarin is inhibited, the INR will increase and suddenly INR is increasing, so bleeding risk also increases. So the best approach is closer INR monitoring and possible dose reduction. So you're going to monitor the INR and you're possibly reducing the dose. Okay. Next is C. First point they have mentioned is warfarin is broken down more slowly. More warfarin stays in the bloodstream. Warfarin effect becomes stronger. Clotting factors decrease even more. Blood takes longer to clot. INR increases. When all these steps this happens when the metabolism of warfarin is inhibited. So, if metabolism of warfarin is inhibited, warfarin will break down slowly. It will remain into the bloodstream for a longer period of time. So, the effect of warfarin will be stronger and clotting factors will decrease and it will take longer to clot the blood. So, INR will increase. Okay, and the last very much important point is warfarin is mainly metabolized by the liver enzyme like cytochrome P450-2C9. Okay, it is metabolized by this enzyme. What is the enzyme name? Cytochrome P450-2C9. So, once metabolism of warfarin is inhibited, this all will happen. INR is going to increase. Remember this. Next is warfarin is metabolized by which liver enzyme? Cytochrome P450-2C9. Number 3, a hospitalized patient is receiving heparin for DVT prophylaxis, develops platelet drop from 220 to 80, new thrombosis. What is the next step? Continue the heparin, switch to warfarin immediately, stop heparin and start ergotroban and give platelet transfusion. Remember guys, due to heparin, there might be a sudden platelet drop. So that is known as thrombocytopenia and also known as a term that is HIT, heparin-induced thrombocytopenia, which happens due to the heparin. So your patient's platelets has been dropped from 220 to 80. Now what we are going to do, we are going to stop all the heparin. Okay, and we are going to start non-heparin anticoagulant, that is argatroban or bivalirudin. and warfarin is not started initially. So B option we are not going to choose. We are going to choose C option because we are going to stop the heparin and we are going to start a non-heparin anticoagulant. We are not even going to continue the heparin. Fine. Next is question number 4. A patient on warfarin presents with serious bleeding and an INR of 6.5. What is the best treatment? So options are stop the warfarin only, give oral vitamin K, give intravenous vitamin K plus prothrombin complex concentrate, or start the heparin. So patient is taking heparin and what has seen serious bleeding and INR is raised to 6.5, which is a very serious concern. What we are going to do in this case? We are going to reverse it. Okay, life-threatening bleeding, intravenous vitamin K is given, PCC is preferred or FFP. This rapidly reverses the anticoagulation. So due to warfarin, serious bleeding is happening. So anticoagulant effect has already shown. Now, but since it is a very serious and life-threatening condition, we have to reverse the condition. So we are going to give him intravenously vitamin K. Which medication is the specific reversal agent for dabigatran? Protamine sulfate, vitamin K, idaruci, sorry, idarucizumab, tranexamic acid. Option is C. Idarucizumab is a monoclonal antibody fragment that specifically reverses the dabigatran. So reversal agent for dabigatran is idarucizumab. Remember this, you might have this question. A patient is discharged with enoxaparin injections. Which counseling point is important? Inject into muscle, inject into abdominal, subcutaneous tissue, massage injection site, take with food. What are you going to do? You're taking enoxaparin injection and counseling point is what? So the site of injection here is inject into the abdominal subcutaneous tissue. Enoxaparin is administered subcutaneously in the abdomen. Patient should not massage the site because it increases the bruising. So once you give enoxaparin injection, you're not going to massage the site because it is going to increase the bruising. And what is the site of injection? That is abdomen. Okay, possible question. Which anticoagulant is contraindicated in mechanical heart valves? Okay, anticoagulant that we should not give in mechanical heart valves. Options are warfarin, dabigatran, heparin, enoxaparin. The answer is B. Direct oral anticoagulant. That is DOAC. What is DOAC? Direct oral anticoagulant. That is dabigatran are not recommended for mechanical valves. When mechanical valves are there, heart valves are there, dabigatran, which is oral anticoagulants, we are not going to give or recommend. Warfarin remains the standard therapy. For this case, warfarin we are going to recommend, which is a standard therapy for mechanical heart valves. Which lab parameter is used to monitor the warfarin therapy? APTT, INR, platelet count, bleeding time. Option is B. When warfarin therapy is going on, we have to monitor the INR. It should not cross 2.5. So, warfarin therapy is monitored using international normalized ratio that is known as INR. Let's have a quick PEBC memory trick. Drugs that increase the INR. Remember it as TAM, trimethoprim, sulfamethoxazole. A is amiodarone, M is metronidazole, and F is fluconazole. And drug that decreases the INR is rifampin. Possible question. Which drug decreases the INR? Rifampin is a drug that decreases the INR. Possible question on trimethoprim sulfamethoxazole, drug that inhibits the metabolism of warfarin, leading to increase in the INR. Okay, so that is trimethoprim sulfamethoxazole. So this is the possible questions on which drugs is going to increase INR and decrease the INR. That is the end of this session. If you like the session, please do subscribe and like to the channel and follow for more updates. Thank you.